Okay, the lower limbs. The lower limbs consist of 30 bones, just like the upper limbs. Almost the same structure. We're going to add one bone at your knee, but we have instead of eight, seven tarsal bones. Instead of eight carpal bones, we have seven tarsal bones. So we end up having again 30 bones on each lower limb. And they're grouped into three sections, just like the upper limb. So we're going to describe the femoral region, which is the same as your thigh. So whenever we talk about thigh or femoral region, is the area between your hip and your knee. Then we're going to describe the bones on your leg, or they consist of three different regions: anterior, posteriorly, and laterally. Is the crural, fibular, and sural. And usually we refer to this section just as the leg, but again, remember, the leg is not the entire lower limb. It's just this section between your knee and your ankle. And then we're going to describe the foot. So let's start right away with the femur, which is the bone that we have. I don't think I can move it. Oh, yes, I can. Okay, which is the bone that we have on your thigh. So again, remember, thigh between the hip and the knee. So this is again a lonely bone located in your thigh. We have only one femur, but this is the strongest, longest bone on the entire body, not just the lower limb, but the entire body. And it has, look, it cannot be seen very well in here. This must be a male, but usually the femur, they go from your pelvic girdle to your knee, right? And the direction that they take is from lateral to medial, from your pelvis to the knee. So the knees are closer together in the midline. This difference is greater in females than in male, because remember we just said that the pelvic girdle is usually wider in females than males. And this explains just that difference of angle, the angle between the femur and the tibia is going to be wider in female, and that explains a lot of knee injuries being more common in females than in males. So what else? Proximally, the femur has this ball. You can see it's completely this round projection. That ball is the head. Do you have a head? The femur does have. So that head is the one that fits into the acetabulum that we just described in the pelvic or coxal bone to form the hip joint. Distally, see that the femur ends in these two round projections. They're called condyles. Aha! Remember the word condyles, which means, what are you going to ask me now? Yes, it's a place for articulation. So the first question that has to pop in your mind is, what bone articulates there? So these are the medial and the lateral condyles. The medial on the same side of the femoral head, and the lateral is contralateral on the other side. And both of these femoral condyles articulate with the tibia, which is the medial bone on your leg. Anteriorly, in the same distal aspect or epiphysis of the femur, we're going to have this smooth surface that is called the patellar surface. Is the surface that articulates with the patella, which is your kneecap. And this is the kneecap, and it's oriented just like that. It's like a triangle, and the base is superior and the apex points inferiorly. And this is that posterior smooth surface that is articulated right here in the patellar surface. Remember, the patella is a sesamoid bone. Remember the classification of bones? So this is a short sesamoid bone that develops within a tendon. So in there, we're going to find the quadriceps tendon. The quadriceps is the big muscle of your thigh. And right within the tendon is where we're going to find the patella, the kneecap. Okay, so see you in the next video where we're going to do the leg, tibia and fibula. See you later, alligators.